Welcome to meeting number 19 of the House of Commons Standing Committee on Veterans Affairs. Today's meeting is taking place in hybrid format pursuant to the House Order of January 25th, 2021. Proceedings will be made available via the House of Commons website. Pursuant to Standing Order 1082, the motion adopted by the committee on March 24th, 2021. The committee is undertaking the study of Veterans Affairs Canada mental health care programs. Welcome to all the witnesses who have taken the time to join us today. I will introduce all of you before you have the opportunity for your opening remarks. First up, Sean Bruyere, Captain retired, columnist and advocate. Also as an individual, Tina Fitzpatrick, and from Army, Navy, Air Force Veterans in Canada and Veterans Association Food Bank, Alan Hunter, National Service Officer and Director. Each witness will have 5 minutes for opening remarks, and after we'll proceed with rounds of questions. I will signal when there is 1 minute left to your time. So please keep an occasional eye on me on your screen. I will simply do this. Don't panic. A minute is quite a long time, and I will allow you to go maybe slightly over. Just try to, when you see the 1 minute, try to start working to wrap up. So first up, Mr. Bruyere, you have 5 minutes. I'm sorry, sir. If you want to start again there, it looks like you're still on mute.
Like I am. I apologize. Technical difficulty.
Okay. Go ahead, sir.
Good afternoon, Chair, ladies and gentlemen. I sincerely thank you for inviting me back. It is well documented that Minister Seamus O'Regan spread falsehoods about me in retaliation for my writing about government's flagship election promise for veterans, Pension for Life. The day after the minister published his defamatory words without warning, consultation, client notes, or justification, VAC sent a letter canceling care for our 6-year-old son. The toll upon my body and mind from my military injuries meant that having my family was nearly impossible. I was 47 when we were blessed with our son. Living with a chronically ill father, he is profoundly sensitive to my physical and mental health. He isn't just worried about his father, he is terrified. Each symptom is an inevitable path to my death. He agonizes that I will be ordered to war again soon. There's no public program to adequately address his safety and health needs. We plan on homeschooling him once I complete my rehabilitation. Meanwhile, we found a caring school that accommodates his empathic burdens. Also, I was allowed to be with him in his classroom, walk him through the hallways, and carry out a morning ritual from anywhere to 10 to 30 hugs until he felt safe leaving his father. When my heart went into a dangerous arrhythmia and I collapsed, my normally clear-thinking wife became paralyzed. My endless barrage of symptoms is too much for her. It was my son who saved me. He found my medicine and brought it to me. He tried to open the childproof container. He kept his cool and handed it to me. He sat by me, eyes watering, the contents spilled out. He looked at my chest, covered in pills, heaving up and down 240 beats per minute. After I had taken my medication, he spoke in a shaky voice. Dada, can I please clean up the pills for you? When Veterans Affairs canceled our son's care that had been in place for 5 years, I sought help from Assistant Deputy Minister Bernard Butler. He was appointed as my VAC contact following the 2010 privacy scandal. I'm my case manager's only client, and she dealt directly with him. Mr. Butler went to Director General Faith McIntyre, whose division spearheaded the Pension for Life program. Without substantiation, both Bernard and Faith McIntyre decided that my son's care did not meet the intent of the program. Bernard Butler never revealed to me that he was also representing VAC in my defamation lawsuit against Seamus O'Regan. I proposed solutions to reinstate our son's care. Even though my case manager and others agreed to appoint an inquiries resolution officer, Bernard Butler and later Assistant Deputy Minister Michel Doiron both intervened to stop the appointment. I regularly asked Deputy Minister Walter Nicinchuk, as well as Mr. Doiron and Butler, to provide evidence that school-aged children should be denied private care not provided by the public system. They ignored my questions. Instead, they repeatedly sent me to my case manager, deflecting VAC's failures, portraying them as pathological manifestations of my mental health. My health deteriorated. Alan Hunter offered to be my advocate. Alan, Perry Gray, and I wrote more than 50 emails and letters to Bernard Butler, Michel Doiron, Stephen Harris, and Walter Nicinchuk. We proposed solutions, reported my deteriorating condition, and asked for evidence supporting VAC's inexplicable interpretation of policy. Meanwhile, I was forced into emergency wards once per month. My 5 to 8 weekly medical appointments focused on addressing VAC's harm. Not once did these senior officials answer any questions. Neither did they or my case manager acknowledge my health spiraling downwards, let alone express concern. The minister and the department also ignored an ombudsman investigation and recommendations into our son's care. It has cost VAC to date more than $75,000 to treat the consequences of denying less than $75 a day for our son's care. The provincial healthcare system has paid a similar bill. Why would VAC seek retaliation? The culture is embedded with an animus towards any veteran who dares criticize the department. When the minister published his article, VAC official Tim Brown wrote, "A minister who will counter and go on the offensive. I've been waiting for this for years." Meanwhile, in response to more than 50 emails and letters requiring decisions to be made by Walter Nitinchuk, Bernard Butler, Michelle Dwaro, and Stephen Harris, access to information disclosures revealed there was no document trail. These individuals snub their noses at Canada's requirement to have an accountable government with transparent decisions. They carry out their work in the murky and highly unethical world of recordless or verbal government. There are others that see nothing wrong with intruding upon my privacy. Christian Lachance, an official in no way connected with VAC's appeal division, was notified before me of the appeal outcome. He immediately informed Director General Field Operations Maurice Savoy, as well as Graham Williams, writing, "The appeal decision will be unfavorable. As a result of the decision, this may escalate." Maurice Savoy responded quickly, "Thank you. We'll inform Michelle Dwaro's office. The Privacy Commissioner has an open investigation into this matter." VAC has a long history of enmity towards me. The 2010 privacy scandal demonstrated that 20,000 pages about me, including falsified portrayals of my finances, character, and mental health, circulated among 850 bureaucrats. However, a subsequent request of 230 bureaucrats who monitored my media activities took 7 years to resolve. The result was 2.1 million pages. I'm also a veteran who struggles on a daily basis with psychological and physical adversity resulting from my military service. I'm a husband to a wonderful woman who gave up much in her country of origin to be with me. Our son's keen awareness to the suffering others weighs heavily on him. When will public servants see the difference between my personal life and my volunteer work? When will they debate facts rather than obsess, scrutinize, and attack me? When will they stop hiding behind secretive government practices showing scorn for oversight agencies while targeting a 6-year-old child? We must wonder whether retaliation against other veterans and their families is standard procedure, or we, the unfortunate ones. What is clear is that VAC senior managers show the hallmarks of cultivating a toxic culture. While they have little concern for frontline workers, they show disdain for veterans. Senior VAC officials hide behind inflexible rules with groundless interpretations, divorced from the lives of veterans and their families. They prioritize evasive communication, fear, condescension, neglect, secrecy, bullying, gaslighting, and shaming. Should veterans question the culture and its policies, these toxic tools are coordinated in a comprehensive attack upon the messenger and sometimes the messenger's children. These are not the government actions worthy of the hundreds of thousands of sacrifices made in Canada's name. Thank you, Chair.
Thank you very much, sir. Up next, we have Ms. Fitzpatrick for 5 minutes.
Hi, my name is Tina Fitzpatrick. My husband is Rod, and he's an 18-year combat veteran with 2 tours overseas. We've been together for 30 years and will be married 25 in July. Rod was always a very hands-on daddy to our girls. We have 2 wonderful daughters, 23 and 19. Our 23-year-old daughter was a competitive swimmer all over Newfoundland for 7 years. And our 19-year-old daughter is a second-degree black belt in Taekwondo and has competed at the national level. But yet, their dad has never seen them compete. He was suicidal in our basement for the majority of their young lives. In 1992, Rod deployed to Croatia, where I believe he was exposed to the worst trauma. At the time, I did not know my husband would return a different man. Flash forward to 2002, now my husband's mental state is slowly degrading to the point where he's having suicidal thoughts daily. Canadian forces were no help, As his ongoing mental health crisis, their answer was to go to a civilian hospital. Canadian Forces sent my husband home with nothing, not even his own personal things from the locker on base. In his words, such service no longer required. After a year of being home with zero guidance, they medically discharged him. Then we returned to Newfoundland so we could be close to family. The next 17 years would be an absolute battle with Veterans Affairs, starting with the complete lack of professional help through psychologists and psychiatrists. We had no idea about mental illness on a personal or cultural level. Medical intervention was critical at this point as his downward spiral continued in front of my eyes. Here's just a glimpse into my daily battle for 10 years. I call Veterans Affairs almost daily, always speaking to someone different, each time having to start my story from scratch. These calls were for prescriptions, doctor's visits, assessments after assessments, being summoned to Veterans Affairs to sit around a large table full of doctors in white coats, asking the most absurd questions. Each of these appointments and visits extremely tough on Rod. Each time the psychologist would say he needs in-hospital treatment, this would result in a several months long approved process. And he was hospitalized 3 times for up to 6 months at a time and always out of province away from our family. Trying to navigate programs and benefits, first of all, you had to figure out yourself what was available. And what he qualified for was like pulling teeth. No access to what was available, had to rely on rumor mills to figure out any programs that could help. This reality was extremely frustrating to deal with. Everything was a fight. No was the final answer. Even though I'm crying and pleading for help while my husband is suicidal in our basement and our 2 little ones are running around my feet, I'm begging and pleading with them to help. But no, they don't. So now it's July 2018. I made a call to Veterans Affairs to see if there was any bursaries were available as our daughter was heading to nationals. The girl who answered the phone asked me why Rod had not applied for his ELB, earning loss benefit, and I told him he did not qualify because Rod had already done rehab. Then she informed me that that's not how it works. So she helped me apply. I really didn't think much about it, but about 6 weeks later, I get a letter saying that Rod did qualify, and it was an extra $1,000 a month. What? This benefit came out in 2006. We could have used that money in 2006. Next, I'm on Signal Hill. It's September 2018, and an event where the Minister of Veterans Affairs, Seamus O'Regan, and the head of Veterans Affairs danced across the stage stating retroactivity is back on the table. This is a yes, Veterans Affairs. So then I meet with Seamus O'Regan in his office where I proceed to tell him about my treatment of Veterans Affairs, in which he said someone would be on Rod's file right away. That was in 2018. I just heard back from his office February 2021 after hundreds of phone calls. They informed me the ELB is not a retroactive, but they wanted to try to get some kind of compensation. April 2021, they are now saying that it's a he said, she said. So my best option is the government. The very government Rod served and protected. The bureaucracy that has been put in place by the empire builders within the Canadian government has created an atmosphere where Veterans Affairs might as well speak a foreign language. The ability to navigate the multiple levels within the bureaucracy has made it almost impossible to avail of services and benefits. All of these battles to get my husband, who was medically released from 30% of his pension to 100% of his pension, took 6 years. In my humble opinion, the very institution put in place to take care of our veterans are eating them alive. Thank you for your time.
Thank you very much. And up next, we have Mr. Hunter for 5 minutes, please.
Good afternoon to all the participants and all Canadians that will be able to watch these proceedings across our nation. Welcome to my brothers and sisters that have decided to dial in the best they can across this country, because this is about you. you have served our nation. At the going down of the sun and in the morning, we will remember them. Andrew, Corporal Kathy, Carr, Sergeant Brian, Chan, Kenneth, Desmond, Lionel, Gunn, Robbie, Hutchison, Kenneth, Mogus, Mike, Oliver, Jason, Ouellette, Jeremy, Tabor, Richard. 10 Canadians, Canadians who have fallen, not in distant battles in faraway lands, save one. Here at home with family, friends, and loved ones who perhaps could not have seen the invisible wounds, or if they did, were not equipped with a mental health first aid skill sets to deal with the most tragic of outcomes, suicide. As a service officer, I am dealing with our veterans and families on a regular basis, and as a director of the Veterans Association Food Bank in Calgary region, I'm dealing with yet another mental health issue that results in our veterans losing families and friends as they spiral into homelessness. Perhaps the feelings of hopelessness that lead to substance abuse in attempts in vain to shut off the video, images, and audio images of war, combat, conflict, and the loss of battle buddies and brothers and sisters who have paid the ultimate price for the service to our nation. My mission today is to speak to the actions, abilities, programs, and services, and perhaps shortcomings of Veterans Affairs and Canadian Armed Forces to help offer constructive suggestions to save the lives of our veterans and families. Being an advocate for one of the participants today, Captain Sean Brouillet, retired, I would also like to share some of the journeys I've been part of with him and his family and the mental health challenges and battles they've had to endure from a system that is supposed to be compassionate, caring, and servant-hearted. In many cases, it becomes the biggest detriment to the mental and physical well-being of our veterans. Lionel Desmond was the tragic consequences of a magnitude of failures on many fronts, as evidenced in the Desmond inquiry. Jeremy Ouellette took his own life in Afghanistan. I'm currently working with a battle buddy of his who has been severely impacted by his death. Jason Oliver was perhaps the most personally impacted I've been in my more than 10 years of advocacy, as I attended the funeral and watched 6 of his 7 children carry his casket out to the waiting hearse, as his widow held the hand of the youngest with unrelenting sobs and tears. My apologies, Mr. Chairman, that in January of this year stopped me in my tracks. I can tell you I was emotional wreckage for quite some time. We are, with the Veterans Association in Calgary, supporting the widow and her kids as they try to move on without husband and father and hero. It is my duty to share and answer any questions as the committee deems pertinent to the hearings. And just the recent development from today, women veterans that have served our nation from coast to coast have reached out to me regarding the recent decision to shut down the Committee on Sexual Assault. These women believed that Me Too had finally come to Canada, but now they've seen by the actions of the government that the Me Too movement is dead and it's not you movement. I'm absolutely flabbergasted by the outreach I've got across the country from women who I've been told 99% of the women that serve in the military have faced some form of sexual harassment. And this piece is going to set us back substantially in treating mental health. And I challenge all of us, put your parties aside and let's look after the people, the men and women who've put their lives on the line, and let's quit losing them to suicide. Thank you, Mr. Chairman.
Thank you, Mr. Hunter, and no apologies are necessary. Up first for questions, MP Broussard for 6 minutes.
Thank you, Mr. Chair, and thank you to all the witnesses for coming forward today. And there's no way over the course of the next hour and 10 minutes or more that we're going to be able to get through all of the questions that I think any member of this committee might have. So I encourage all of you to submit to the committee any afterthoughts that you may have in improving the system. And that's really why we're here. Sean, you came and you provided us with testimony as we were discussing the caregiver benefit. And you talked about some of the challenges, the many challenges that exist in dealing with veterans. And you also offered at that time to provide solutions. And that's why the committee invited you back. I know it's well documented what you've gone through in your CBC article that highlighted that was written by Murray Brewster. So I don't want to focus on that. I want to focus on how the situation can be fixed. And let me start by saying this, that as a member of this committee, I can tell you that we're all interested in resolving this issue. And I've oftentimes started any discussions that I've had with veterans, their families, advocates like yourself, Sean, suggesting that this is a generational problem that has existed. And it's been a problem for the Conservative government when we were in power as well. And I'll acknowledge that, not just the current Liberal government. The whole intent of what we're trying to do is to fix this. So Sean, to you, give us some suggestions on what you think is a solution to resolving many of the issues that you've highlighted, Tina and Alan as well.
Thank you very much, Mr. Bristard. And to that end, I submitted a 40-page report with 53 recommendations. These are very substantive recommendations. Why? Because, listen, we've been looking at this problem. Me as an advocate, I mean, not much has changed in 20 years in the way that the department deals with veterans with psychological injuries. Yes, they've advanced vocational rehabilitation. Yes, they've helped veterans with minor injuries and minor disabilities, but they still cannot bend their head around the lifelong commitment of care that is necessary for veterans with psychological disabilities that inherently have complex needs. A perfect example of that is that what's called a POC 12 mental health care policy says that all veterans with complex needs, with mental health problems, will receive case management. Only a quarter of veterans with mental health disabilities are actually receiving case management. But it goes beyond that. Veterans Affairs starts off with a paradigm that says, the veteran comes to them and the veteran's asking, hey, how can we as a family deal with this? Veterans Affairs' answer to that is, how can we as a department deal with that? That is a fundamental paradigm distance that is miles wide that Veterans Affairs doesn't know how to meet up. So I would say that we have to start from the top up or top down and the bottom up, and we have to have a fundamental rethink about how this department works. Right now, the department is structured so that the organizational tools of the department are co-opted by selfish career progressions of the most senior managers. They may be well-meaning, but they are 20 degrees removed from the actual reality of what veterans and their families live. And what we really need to do is we have to completely rethink this department. First of all, it has to be taken out of Charlottetown. It's the only federal department that exists outside of Ottawa. It is far from oversight agencies. It is far from the culture of veterans and their families, and it's allowed to, have a 40-year culture of basically disconnecting itself from not just veterans and their families, but Canadians as general. It's hypersensitive to criticism, this department. We have to really start. I would suggest, some number one things that can be done is that we have to have an oversight agency that could check in on the department, an ombudsman that is legislated, that has the powers to decide its own agenda of investigation. That on top of that we have to have appointment bodies of advisory groups that are completely independent, not stacked with Veterans Affairs bureaucrats. That we have a board of directors to which the board of directors could report to committee, to Parliament. And that board of directors would be a wide swath of Canadians that would independently review the actions of senior leaderships. At the level of working with veterans, we need a collaborative care management program that has independent practitioners, that every veteran that has a mental health injury is assigned a contracted primary care doctor that's independent. The team would consist of a doctor, an independent case manager, and an occupational therapist. Veterans Affairs would exist to merely implement all the care and treatment that is recommended by this team. Veterans Affairs would not exist to scrutinize these requests, but would exist to train the senior bureaucrats to learn what veterans need. And to that end, senior bureaucrats should be manning the front lines at least one week a year. They did this with Service Canada back in 2000, and it worked amazingly. Unfortunately, the rest of the bureaucracy didn't like the idea of directly serving Canadians at the front line as senior bureaucrats. But we can reinstate that with Veterans Affairs.
John, can I just, and I saw the
Sure.
chair put up a minute hand about 30 seconds ago.
Sorry, John.
That's okay. No worries, because I really want to hear what you have to say. there are some very good people that work for Veterans Affairs Canada as well. And I hear your
Yes.
side of it, but I also hear of some good casework that's being done as well.
Yeah, no. Let me emphasize that the culture at VAC has nothing to do with people themselves, right? The people are all well intentioned. They're all working very hard, but they're working hard on the wrong paradigm. Okay, and at Veterans Affairs, that we have a frontline staff that is completely ignored by the senior leadership. Continuous improvements, or what they call improvements, policy changes, are inundating the frontline workers. They don't have the time. We know that. I mean, more than 50% of the time a case manager is taken up.
Thank
and
you.
they want to care for veterans, but they don't have the tools. The senior leadership is not supporting the front line in providing that care.
Thank you, Chair.
Thank you, sir.
Yeah. Yeah.
And up next, we have MP Sampson for 6 minutes, please.
Thank you very much, Chair. And I want to thank all three of you for your presentation. It's very difficult to listen to some particulars, and I thank you for helping us better understand some of the situations that you faced and that others have faced. And I very much appreciate the focus, as Mr. Brassard said, on finding solutions that can help us improve the life and support for veterans and their families. I guess I'd like to look at some of the programs that exist today and get some feedback from you on those programs to see how we can improve those better. So if I start off with the Assistant Service Program, VAC Assistant Program, which is a 24-hour line that allows you to connect with professionals, and it gives you access to these professionals. So I guess my question would be for you, for any one of the three of you, when you call these people, what are some of the questions are being asked? Are they asking you questions? Are they asking you what some of the challenges are before they assess you, or also, are you talking to the same individuals every time you call? Can you tell us a little bit about your experience with that system?
From my perspective,
who's the question to? Sorry.
It was any one of the three. If they use that service, can they give us feedback on the service?
Sure. Mr. Hunter had his hand up there, and
Okay.
Sure. Thank you, Mr. Chairman. So part of the challenge is the people that answer the phones and get the questions is a lack of understanding of who's on the other end. So typically the advocates end up making those calls and answering some of those questions. One of the biggest challenges that I've seen faced by veterans across the country is that if a veteran is in crisis, a veteran is having mental and physical impairment difficulties, trying to navigate all of the myriad of questions and check boxes, if you will, that have to be filled out in order to get to the next level to, are you entitled to it? What have you been given so far? Did it work? All those different questions. You end up with many, many cases of veterans just hanging up the phone because they decide in their own minds that they're not going to help me. And it's been said across the country that the system is set up as to delay, deny until you die. And so I want to pay homage to all of the people across the country in VAC departments across this nation that have helped me personally save lives from veterans from coast to coast. We can't deny that fact, but they're faced with a system that is as complex to them as it is to the end users, which is the veteran that is on the other end of it. And if the veteran's family is stepping in, as Tina alluded to, trying to get help, when you have to sue the government, quite obviously, the program is designed for the bureaucracy to succeed, but not the end users. And that's the challenge. And that mental health piece of that is we are losing veterans all the time to suicide because they give up. And we're a nation that doesn't give up on our people. We're not a nation that should be giving up on our soldiers and our veterans. And whether they're in service or they're out of service, these are the challenges. The first question is, where did you serve? All those different pieces, and someone's opinion might be, well, I'm sorry, but you don't qualify. And they call the next worker and they say, you qualify, but we're going to need a telephone book full of paperwork filled out before we can get you to the next stage. If you're living in your car, that's not going to get you to a very good place. Thank you, Mr. Chairman.
we have anyone else that would like to answer, or I'll go on to another question?
Miss Fitzpatrick has her hand up as well.
Thank you.
Hi there. I've called VAX number, the 1866 number, thousands of times. And starting in 2003, right to my last phone call, which was in 2018. And I'm going to tell you, it's such a flawed system from to beginning to end. So you get on there, you have to give your husband's number, which is not a big deal, but you have to go over your story every single time. There's no case managers. There's never been a case manager. My husband has been out now 18 years, and he's never had a case manager. So when people say about case managers, I don't know anything about that. Every time I've ever called, I've had to start from scratch and tell my whole story, depending on what the fight was for that time. Because there's been multiple different things, from prescriptions to appointments to everything. Even like this is one example. A veteran, if they go to their psychologist or psychiatrist, they would put in every couple of months. They'd put in and get money for fuel, that type of thing. My husband hasn't done that in probably 12 years. Because they made it so difficult. They keep changing it. And now, the last time I checked, which has been a long time now, they had to bring the paper with them, and they had to make sure that the psychiatrist filled it out, and then and then the front desk had to sign it, and then my husband had to fill it out, and he wasn't going at it. So we haven't availed of that in probably 12 years for sure.
Thank you. Mr. Burry, I see you have your hand up. Unfortunately, we're out of time for this round of question, or this particular question. But up next we have MP Desilets for 6 minutes, please.
Merci, Monsieur.
Thank you, Mr. Chair. First of all, I'd like to say that I'm a little bit off balance given the testimony that is very emotional and very troubling, very troubling. Mr. Hunter, you said, and I quote, that the system is becoming the enemy of the veterans. I wrote that down, and I'm going to keep that because I find that this represents somewhat what we've been hearing. And we're all looking for solutions, you should know, and ways of improving this system, which is involved in a number of weaknesses. Mr. Hunter, the first question to you, we have an opportunity to talk in this committee about homelessness, which affects a lot of our veterans. We've talked a lot about it, but not enough, to my mind, of course, taking for granted that the main cause of homelessness among veterans is often a mental health problem. So we may ask ourselves, and rightly so, I think, that the government, the government has to counteract that at the source. So more precisely, my question is, do you think that the government, Mr. Hunter, is acting effectively in preventing homelessness with its various care programs for mental health?
Thank you, sir. So let me first say that the Veterans Affairs staff across the country are doing miracles with the system that is designed, that is very complex, but really doesn't get to the heart of the matter. And do I think that the government's programs are effective? I think from a percentage standpoint, the percentage is very low that it is effective, because we're starting to, and now with COVID being thrown in the mix, the homelessness of veterans is increasing dramatically. And one of the things that's very hard to do is find female homeless veterans, because they've faced a number of battles. We talked just briefly about the sexual assault traumas that a lot of female veterans went through. But to go out there and expose yourself once again to a system that was supposed to protect you, we're ending up with women living in cars and homeless shelters. And to try to get them to say, "Are you a veteran?" A lot of them don't want to tell us that, because our veterans are supposed to be our heroes that don't have weaknesses, that can, leap tall buildings in a single bound and all the things that go with it. But reality is that these are people that we need to, so when we go out there looking for veterans on the streets out here in Western Canada, they're not easy to find like your typical, and it's a sad thing to say, typical homeless person, because we train them to not be seen. So unless you have a military background, unless you have the ability to see where someone is going to conceal themselves, we've had veterans freezing to death in the winter because they concealed themselves and nobody knew they were there. So you know what, if we're doing a good job, that would mean that the suicide statistics are getting down to a point where we can trumpet that across the nation. That is not happening. And there's lots of ways we can fix it, but the ways we're doing it, is, once again, it's designed so that the bureaucracy succeeds, but not so much the end users.
Excuse me, Ms. Hunter, I'd like to continue by asking you, do you have the impression, that's my perception, but perhaps I'm wrong, that it's easier in our bureaucratic system to send out money to try to soothe ills rather than to prevent those ills?
So yes, sir, and we spend vast amounts of money and we send it out, and then what I see as a advocate and a service officer is that money and those sums of money are put out there to the public across Canada to say, see, we're addressing and fixing the problem. Look how much money we spent. But if you don't look at the end use of how that money was spent, again, the Veterans Association Food Bank in Calgary applied to the Veterans Family and Wellbeing Fund for a housing project because Homes for Heroes got them off the street, got them stabilized, but now the rents are so high that when they move out of there, they're ending up in a system that they can't afford. So guess what? They end up back on the streets again because they cannot move to the next level, and so things like that. So we say, here's how much money we've spent, but we don't track the results. We don't say, look at the successes. The 10 people that I talked about that took their lives, to me, 10 is just the ones I could put out there with a few days notice. I can tell you there's hundreds of them. And remember, when each veteran takes their life, they're leaving a family behind to deal with the aftermath. So how do we track that? Do we look at the family and what's happened to that family as they go? I've got my own family, generations of family serving our nation. I've got friends who have got out that are struggling with their own PTSD and mental health, whose kids are now in the service. And they're all saying, wow, what's going to happen to me when I get out? So in answer to your question, we spend a lot of money, but we're not accomplishing what we should be accomplishing, which is making sure that we put them back on track and give them the right to a good solid life. Mr. Bruyere was a good example of why would anybody think it was okay to take away funding from a 6-year-old boy? Absolutely unheard of, when they gave money to a convicted police killer because his father was a veteran. That's absolutely absurd that we would allow that in a nation like ours.
I'm afraid, I'm afraid that's time, sir. Thank you. Up next, we have. Thank you.
Thank you.
Up next, we have MP Blaney for 6 minutes.
Thank you, Chair, and I want to thank all of you for your testimony today. It's hard to listen to, so I can only imagine the reality of living it day in and day out. So I just want to express my appreciation for you coming here and sharing that with us, because I imagine that is also exhausting. If I could go to you first, Mr. Bruyere, I really appreciated your testimony, and I've seen briefly the recommendations, and I'm going through that. But I'm just wondering if you could talk a little bit about how the minister and the department handled the other ombudsman investigation sent to the minister. I think that's really important that we capture that on the record today.
Yeah, thank you very much, Ms. Blaney. What happened is that the Craig Dalton, unlike the previous ombudsman Guy Perrin, thought that it would be, and I agree, it was an excellent plan to have a more expeditious process of having recommendations acted upon. What was happening under Guy Perron previously was that they were permitting the department to delay for years to address recommendations from the Ombudsman's office. So he submitted recommendations to the department on 4 files in April and May 2020. Now, previously, he submitted to the minister, but previous to that, he gave the department 3 months to address those concerns. In all 4 files, the department completely dismissed the Ombudsman's concern. I mean, this really speaks to a fundamental problem in the culture of the senior leadership that thinks that they can snub their noses at an oversight body like the Ombudsman. The Ombudsman then decided after 3 months that he would send those 4 files off to the minister, because if the department won't deal with it, well, then it's the minister's job to deal with it. Those 4 files went to the minister. They sat on the minister's desk until Alan Hunter wrote to the minister and to Walter Natinchuk and said, hey, Sean Bruyere is going in for a heart procedure in the beginning of December 2020. And then all of a sudden, all panic occurred in the minister's office, and 3 files were quickly addressed over the next 4 weeks. And all 3 files were ignored almost completely, the Ombudsman's recommendations. The 4th file was just released, so almost a year after the minister had it, and it was a favorable decision. But it also begs the question: we've got a department that is just burdened by these delays because of over bureaucratic processes, and the minister sat on those files when he could have personally had those addressed with a signing of a pen within a few weeks, and he didn't do that, and that's very disappointing and disillusioning for veterans in general and their families.
Yeah, thank you for that. That's very helpful. And I agree, and I appreciate so many of you talking about how hard the workers are doing their work in VAC. It's not that they don't care. I've heard again and again, but the bigger problem is sort of the systems that they're put into. And what I've heard from multiple veterans is it's starting to feel like we're going to an insurance place where we have to prove everything instead of going to a place that's supposed to be there to support us. And so one of the things that both you and Ms. Fitzpatrick talked about was sort of the culture and how preventative it was for you to actually get your needs met. I'm just wondering if you could talk a little bit about maybe one specific thing that you think would make, and I know there's many recommendations, but one that you think really would be pivotal in making a change for the services and the supports that should be there for veterans.
So thank you, Ms. Blaney, for that question. I think fundamentally is that we have to take away this interdisciplinary care team that they have at Veterans Affairs. It is a policy interdisciplinary committee that rules on files of veterans that they've never treated. It provides sort of a fake front that Veterans Affairs really is using a collaborative interdisciplinary care model. And what we have to do is take that out of Veterans Affairs' hands and put it into actual practitioners that treat veterans. Because this interdisciplinary team within Veterans Affairs is truly, that is an insurance model. It is a group of policy experts that sit around and decide how to deny care. We need a care team that knows the veterans, that sits outside of the department, and they say, how can we provide care for this veteran?
Well, thank you for that. And one of the things that I've heard, and I'm going to come to you, Ms. Fitzpatrick, with this. You talked about never having a case manager. And I've heard a lot of veterans talk about how good it would be to make that call, having somebody on the other end who knows you, knows your family, knows the file. And so when you're sharing what's happening in your family, that there's somebody there who actually has built up that relationship with you over time. So you say you've never even had a case manager. And I'm just wondering if you could speak to, you articulated really well what it felt like to continually have to retell your story. But maybe if you could talk about the impact that had both on you and your family.
It was huge, actually. My husband was very, very, like his percentage for PTSD was very high, and he was suicidal for 6 years in our basement. Every time I reached out for anything, I never got any support. It was a fight. I had to fight for everything. And there was never a case manager. Like I would call, I would talk to whoever it was. They would send me on to somebody else, or they would put me on hold for hours at a time, just sitting there waiting. And I would come I'm talking about like for all of his prescriptions, for all of his different assessments, because they do assessment after assessment, all of that. There was no person that I could call at one time. And if we had one, it would have been awesome, because then she would know our story and she could help us more clearly and help my husband when he needed it, not be passing the buck to this one, to that one. And then, and then my husband's file was on the minister's desk as well. Like, it's just been a roller coaster ride. And I have 2 daughters, and guess what? Their Veterans Affairs is a bad word to them. They think that it is a bad word in our house. That's how bad it's been. Thank you.
Thank you. Up next for 5 minutes, MP Doherty, please.
Thank you, Chair. I want to say, first want to say thank you to Mr. Bruyere, Mrs. Fitzpatrick, and Mr. Hunter for your testimony today. I also want to say thank you for your strength, your commitment, and your fight. As many of you, as you know, that since being elected, I have been a passionate champion for our veterans and our first responders. I have sat with many families left behind to pick up the pieces, and I've sat with many veterans who are shattered, who feel that they serve the country and our country has forgotten about them. And so I really, truly appreciate your testimony today. Mr. Hunter, you mentioned about the committee shutting down the investigation in the military sexual trauma. What message does that send to our female veterans and military?
Sir, thank you for the question. Let me just read to you the response I got from an organization that is specifically designed to deal with women in the military. I can honestly say that 99% of women that have served have been sexually harassed or assaulted. We have proven ourselves in service and do not deserve to be treated as second-class citizens. If what happened to us happened in the civilian world, many high-ranking enlisted and officers would be discharged with a less than honorable discharge. The good old boys club is not tolerated in civilian life, nor should it be in the military. Shutting down the committee is giving the message that what happens to females in the service is not important and that we are second-class civilians. The committee has not even gotten around to dealing with males being raped while serving. And this woman was in tears when she sent this to me. And so that is the message coming from women that have served our nation, not from Ellen Hunter. This is from the women who have faced this and can't come forward because guess what will happen to them with their spouses and with their careers. Thank you for the question. I appreciate it.
In your opinion, has this put our female, the females in our military further at risk?
Well, I can say that since that happened, I've been getting contacted by females that have been assaulted, raped, and abused in the military. Some are still serving. They're absolutely terrified to come forward. In their words, this has said that women are second-class citizens in the military, and we're shutting down this committee because there's much worse there than we're prepared to allow Canadians to hear, and that's unacceptable in any nation.
This next question is for the three of you. When our Prime Minister and our ministers stand before microphones and say that they'll always stand with our veterans and our military, how does that make you feel? Go ahead.
Thank you, Mr. Doherty. I've long written about the huge gap between the rhetoric and the actions. And what happens is especially veterans with mental health illnesses, is when they hear government say these words, but the actions show something different. When they show up at Veterans Affairs and they meet this debilitating bureaucracy, when the letters come in those brown envelopes that say no, when they have to go on the wait on the phones. I mean, these are all messages saying, hey, wait a minute. The prime minister said something very meaningful. I believe in that. I was willing to die for that. So if the government is not going to treat me the way that the government promises, then the fault's me. I must be at fault. I must be the one. And the shaming is so intense. And I have spoken with countless veterans, and I can tell you, including myself, that the suicidal reaction is immediate. The shame is immediate. And I don't think there needs to be a widespread sensitivity training in mental health illness, especially for veterans, throughout Veterans Affairs, and I would say in Parliament.
I agree.
Yeah.
Ms. Fitzpatrick, how are you? And how's your family?
Sorry. Good. So we're good. We're good. It's been a long road, but it's okay.
I just want to say thank you for your strength, and thank you for what you're doing for your family. And for me, I have sat. And go ahead, Mr. Hunter, if you've got something. Go ahead. I have sat with countless veterans and families that are just shattered, and listening to your testimony is absolutely just heaps it on there. For me, it just seems like we're not going forward. We're 3 steps backwards.
Absolutely.
Thank you, Mr. Doherty. Up next, we have MP Amos for 5 minutes, please.
Thank you, Chair, and a particular thanks to our witnesses today. These are difficult stories to tell. These are, they're emotion riddled, and I think all of us feel that the burden that you bear telling your stories, because it's important for Canadians to understand the plight of many veterans' families. I was particularly struck by the commentary around that sort of the negativity towards the bureaucracy, that sort of feeling of that oppositional feeling. And one thing that I wonder, I guess I'm trying to explore this in a different way with you, because oftentimes large institutions, which aren't represented by any one individual, but are a collection of individuals and rules and processes, often they work better if they're given positive feedback where it is working, because that helps identify where it's also not working. So I want to go through a list of some of the services in terms of mental health that Veterans Affairs provides, at least in this fiscal year, in the fiscal year of 2019-2020, where 84 million was invested in the following way. And if our 3 witnesses could advise what were the areas where it actually is functioning well, that would be helpful, I think. So I see here that there's funding for 11 operational stress injury clinics across the country, 10 of which are outpatient and 1 inpatient. There's the operational stress injury social support services. There's the Veterans Affairs Canada Assistance Services toll-free telephone line. There's the veteran-specific mental health first aid. There are 2 mobile apps, the OSI Connect Mobile and PTSD Coach Canada. There's a mental health directorate within the department. We've heard some commentary around that already. There's the operational stress injury resource for caregivers. There's the Veterans and Mental Health online tutorial. And there's access for medically released veterans and their families to 32 family resource center sites across the country, as well as the Family Helpline and familyforce.ca website. Could each of you comment as briefly or as long as you'd like on what is working?
Mr. Amos, I really appreciate your question, and I just wanted to speak to the paradigm that we have to complement the bureaucracy so that they let their guard down and they do the right thing. It has been my experience after 20 years that when you compliment them, that what happens is that the bureaucracy immediately says, "Hey, we're doing a good job. We don't have to do anything different." The problem is with the funding for mental health is we have to understand the users first. Let's not understand the bureaucracy. Let's understand the users, the families and veterans first. When we understand what their needs are, When someone suffers a mental health illness, it is 24 hours a day, it is 7 days a week, it is all year long, it affects everyone around them. And what we need is a comprehensive system that will address that the veteran needs to know that they can get that care, like Tina said, to call a case manager, but that's only a half measure. And all of the mental health programs at Veterans Affairs are half measures. And they only work for those that are persevering and those that are articulate and those that can fight. But what veterans need that are suffering from mental health illness is they need someone and a team that will be there all the time, every day. Because with that security, only then can you take the steps forward to better one's life.
If I may.
Please.
Continuum of care is a term that's used in the medical profession. It's critical from inception to completion to make sure that that continuum of care happens. Continuum of care, all of the programs that you have mentioned, and we've spent $84 million on these things. That's great because the initial contact, wow, here's a person that leaves with a feeling of, man, there's some things in place that I might be able to access, and I might not be in this place again. And then the next piece comes in. Okay, so let's look at your account. Have you filled out this form? Have you filled out that form? No, sir, we didn't find your advocate's consent notice, even in fact it was in place, and all those things. And so the person on the receiving end of that continuum of care, the programs don't recognize that if that's an individual, as Mr. Brouillet alluded to, isn't articulate and doesn't understand how systems work, in the mark of any great organization, especially the military, is the leadership. And the leadership has to say, we recognize that we're dealing with multicultural issues, educational issues. A lot of people join the military because life wasn't so good in the family, and they go in and they get trained in a trade, and they come out with not a good academic education, and they're thrust out there. Here's a whole pile of money. They spend it all, but they haven't addressed all the problems, and now they're ending back very cyclical. So again, some of the programs, and I can tell you my own experience as a service officer, that indeed some of those cases they've saved lives, but in other cases, as I've mentioned, those people didn't make it and they're no longer with us, and their families are left behind to bear the burden of what could we have all done different. And I would like to say that everybody in this committee, if you believe that women are not second-class citizens in this system, especially female veterans, that you do something about it, not just talk on committee, that you go out there and you say that we are not going to accept from our government that we're going to continue to put nice platitudes out there, but not do things to deliver these veterans from the battles that they face at home.
Thank you, Mr. Hunter. Up next, MP Daisy Lay for 2.5 minutes, please.
Thank you, Mr. Chair. Ms. Fitzpatrick, I'm perhaps repeating myself, but in fact, I find you very brave. I have a great deal of respect for you. You've been in contact with the Department of Veterans for 15 or 17 years. You mentioned those two numbers recently, whatever. You said that you've made thousands of phone calls to the department. On Monday, a couple of days ago, in front of the same committee, the Deputy Minister, Mr. Natinchik, said, the Deputy Minister said that he reduced the answering time to 2 minutes. Personally, it's been 2 days ago, and I don't understand that answer, but I got him to repeat it. I don't know if he was referring to one or several departments, but my question is, on your part, thousands of phone calls, and in recent years, because the department has changed, I'm convinced, but in recent years, or in the last few years, have you received answers within 2 minutes?
Absolutely not. Never. In 2 minutes, no. Last time that I dealt with, and this was the OSI clinic, was in 2011. My husband was called and asked to go to the OSI clinic. There's none in Newfoundland, so he had to go to New Brunswick. So he didn't want to go. because he said he didn't want to go over his trauma. He sees a psychologist for 17 years now, the same psychologist. He didn't want to go. They insisted that he go to this OSI clinic in New Brunswick. We both went. We went for 5 days. We came back. We had stayed in a hotel we had no rental car. We stayed in a hotel with no restaurant. So we were told to take cabs everywhere and keep all of our receipts. I came home. I did exactly what the girl told me, kept all the receipts, sent them in. I get a letter back and saying that the only receipt would be they paid back our receipt from the airport to the hotel. And at that point, that was 2011, I said, okay, we're done with you guys. And I hadn't contacted them, maybe for prescription renewals and that kind of thing, but I was done. But
Thank
then in 2018, I did contact about the earning loss benefit. And I was told by Seamus O'Regan in 2018 that I would get an answer, and I got an answer 2 weeks ago, literally 2 weeks ago.
Okay. Thank you.
Merci, ça répond.
Thank you. That answered the question. Mr. Bruyere?
We're well past your time. I let the witness finish, but with 2.5 minutes goes by real quick. Possibly that question may come up again in the coming rounds here. Up next, we have MP Blaney for 2.5 minutes.
Well, thank you so much, Chair. I'm going to come back to you, Mr. Bruyere, because I keep thinking about the startling story that you told us about your son having to help you with your pills when you were having that incident. And one of the things that concerns me greatly is we're sending veterans home to families, and they have severe challenges, and we're sending them home without providing any support to those caregivers, those children, and we're not providing any training to say to them, these are some of the things you may expect, and here's who you call when those things happen. And we're going to support the whole family and staying together, because I can imagine when it's that kind of stress, it's very hard on the family to stay together. So I'm just wondering if you could speak to that, because you talked about your son losing the care and all of these other factors. I just really want to make sure that this committee understands the impact on the family and the specific needs that the family of the veteran require.
Thank you, Ms. Blaney. I'll give another anecdote of what happened with my son quickly, is that when I went in for the heart procedure in the hospital, my son can't be away from me. So at 4:30 a.m., as I'm lying in the hospital bed, I get a call, and that's my son crying. And he can't sleep. He hadn't slept all night till 4:30, and he needed to hear my voice before he went to bed. Now, that is a burden on a 6 and a 7 and 8-year-old that is just too much to bear. And when I suggest, about what can change at Veterans Affairs in terms of this collaborative care, continuum of care program that's independent, that care team has to include the family members and the veterans, and the family members and veterans get to decide, how do I deal with this problem? It's not Veterans Affairs saying, how do I deal with this problem? It's the family that gets to say that, and the family gets empowered, and even the children get empowered. And that's what I try to do with my son, is empower him. But I would really like some extra assistance to know that he's going to be safe when I'm not with him. And that's why we had the care in place. And that's why it was so devastating when it was taken away.
About 15 seconds.
Yeah, I thought so. Thank you for that. And I will say that what I hope to have happen later on today in this meeting is I think we should add to the motion that we get a response from VAC on this testimony. So I will be bringing that forward soon.
Thank you, Ms. Blaney.
Thank you. And next for 5 minutes, MP Davidson, please.
Well, thank you. Thanks, Alan. Thanks, Tina. Thanks, Sean. I'm new to this committee, and thanks for allowing me to take the time today. Tina, the good news is I pulled the Auditor General's report on call centers, and it is a damning report. It says that in addition, including Veterans Affairs, None of the call centers had any service standards or the likelihood that callers would reach an agent or the accuracy of the information they would receive. And as well, there was absolutely no service standards. In 2019, there was 208,000 calls to Veteran Affairs. 43,000 were hung up on or unanswered. So that is supposed to be there to serve Canadians, and it's clearly not, and that is according to the Auditor General's report. And it's frustrating to me as a new MP to, you know, have you here as witnesses, and I often wonder as a new MP, what building do all these reports go, and absolutely nothing happens. She's got to be choke full of report, and nothing happens. Anyways, to my questions, I had veterans reach out to me. I reached out to a couple veterans. Just so you know, I have a Silver Cross mother that works for me. Her son was killed by an IUD in Afghanistan in 2010 and made the ultimate sacrifice, Brian Collier. And, you know, monthly, and I'll say this to Sean, Alan, and Tina, we go through monthly, weekly, even moments, her and I in the office, where, you know, there's a breakdown and there's absolutely no services for her. So I would ask one to answer about that, because I know time's critical here, Sean. But I also have a question. Veterans who receive disability benefits from Veterans Affairs Canada are now able to earn up to $25,000 without it impacting their diminished earning capacity. However, veterans who receive disability benefits from Manulife are apparently not allowed to make anything. I'm looking if you have any input on that, because I have some veterans in York Simcoe, my riding, that are very curious of that. As well, if one of you could speak to, veterans are responsible for paying upfront costs for medication to treat injuries that they receive when in service. And they are waiting over a year, I've been told, to be reimbursed, which is having implications on their health and their finances. And to me, this is also shameful. So if we could start there. I unfortunately only have 5 minutes. I got many more questions, but I will start there.
Can I go first there, Alan? So Mr. Davidson, excellent questions, excellent points. You know, first about the call centers, that is a perfect example. It seems like such a minor thing, but it's a perfect example of how the bureaucracy prioritizes statistics instead of results. So the only concern in Veterans Affairs is how quickly do they answer the phone? The concern is not whether it's been resolved, whether there's been follow-up, whether there's been help offered, whether there's going to be a practitioner assigned. That's not the concern. So the bureaucracy, just like the case management ratio, right? Let's get that case management ratio down. But are we asking whether that veteran actually received true case management? Did they really get help? Did they move on with their life? Did they progress? You know, in terms of the medication and the upfront costs, I've gone through a number of practitioners that will not deal with Veterans Affairs. It is too burdensome on them. So I have to do the paperwork for them. It's absolutely inexcusable. Other practitioners say, no, I won't see you because I don't want, you know, I don't want to have the burden of you dealing with it or me. So I just don't want anything to do with Veterans Affairs. That's a truly sad situation in my mind.
Oh, it is truly sad. And I thank you for those comments. Again, I'm on your side on this. This is something I know we're all going to work together as a committee, and hopefully another report doesn't go to some building and collect dust and everyone's back here 5 years ago, or 5 years talking about the same stuff again. Alan or Tina?
Yeah, I can tell you.
Very briefly, please.
Many years ago at a stakeholder summit, I was told by Deputy Minister Natinchuk and also the Minister for the moment, Seamus O'Regan, that they were going to make sure that they looked into intergovernmental, so CRA, Health Canada, all these things, to make sure that anything we're putting out there for our veterans isn't going to be a detriment to their care and continuum of care. None of that has happened, and that stakeholder summit was 2016. So here we are, as you alluded to, 5 years later. We heard lots of good words and lots of good promises, but nothing has emerged from that.
Thank you, sir. I see, Tina, you have your hand up. However, we're out of time on this question. So maybe we'll be able to circle back. Up next, we have MP Casey for 5 minutes, please.
Thank you very much, Mr. Chair, and thank you to all of our witnesses. A very compelling and sobering testimony today, indeed. I think I want to start with something that's fairly simple. Mr. Hunter, you indicated that one of the roles that you undertake is that of a service officer. Can you explain to us just what that entails?
Yes, sir. Thank you for the question. So typically a service officer, many organizations have them. This is my second organization that I'm working as a service officer. So what happens is a veteran that is having a difficult time navigating the system reaches out to a service officer and hopefully gets the program started. And in a lot of cases, I'm a volunteer. So I do this in my spare time, which in a lot of cases, depending on the caseload and people coming to me, I expect it's going to escalate with the latest from what we heard about our female veterans. But what happens is I typically get the cases where they've almost given up. I'm the ones, as Sean alluded to, he's been an advocate for a long, long time, and he had to reach out to me. I typically get the cases where people have almost given up. They've said, look, I've fought with VAC. I've asked VAC questions, as Tina has alluded to, years and years of trying to get answers. I can tell you my own personal experience. VAC does a good job in answering many questions, many phone calls and many questions in 2 minutes, but more often than not, the answer is no, or start again. And so once again, the service officer's role is to try to keep that veteran on this side of the cliff, if you will, to make sure that they don't do something to cause self-harm. You got to remember the next step for a veteran that's being told no could be substance abuse. All the things that go with that could end up, and again, I alluded to that earlier in my opening statement, as to suicide. That's the ultimate failure when a person takes their life of a nation and the organizations built for it. And again, I can't stress enough, I have to absolutely thank the countless people across VAC that have helped me keep these people alive and to keep these people going for one more day, one more phone call. But as Tina alluded to, some people just don't have that. And when you got a 47-year-old man that takes his life and leaves 7 kids behind, we've got a system that needs some things that have not been tried before. We've been talking about this. Sean's been a service officer for decades. I have more than a decade. And we're talking about the same things now that we were talking about in my first trip to Ottawa. And so a service officer is the one that's kind of the one that's trying to hold on to that individual, male or female, to say, let's try one more thing. Let's try one more day.
Mr. Hunter, thank you for that. And the reason why I asked that question, I had a sense of I knew what the answer was before, but as I heard Ms. Fitzpatrick tell her story, and as I heard you introduce yourself as a service officer, it struck me that that's something that she could have used. Is there an availability? Is there an option? Is there a possibility of her connecting with a service officer in her neck of the woods, and how would she go about it?
Well, and so there are lots of service officers out there. I can tell you, I'm not sure, and I'm going to hook up with Tina later to make sure that we do have a service officer and an effective service officer are two different things. There's lots of organizations that service officers out there, and typically what they do is they take the answer from VAC and they give it to the veteran and say, I'm sorry, but I've looked into it and you don't qualify, or that only applies on days that end in Y and different things like that. So if a service officer is committed and a service officer is going to make sure, I always say this, and I've said this to VAC for a long time, I'm the guy that's going to help you get to yes. Mr. Natinchuk said to me many, many years ago, I'm the guy that's going to help you get to yes. I said, good, I'm going to hold you to that. And I'm going to be the guy that when I come to you, I'm not going to waste your time. I'm not going to ask for silly things that people aren't entitled to. I'm going to put facts before you that allow you and your organization to get to a very easy yes. And in Mr. Bruyer's case, I put it before them. I got an unsolicited letter from the minister saying we've examined all the things and the answer is still going to be no, even though it wasn't supported in policy. It wasn't supported in any of the case management notes or records that unfortunately weren't kept very well. So the service officer has to be able to have compassion and understand the system enough to say that Ms. Fitzpatrick, we're going to make sure that we get you some resolution, and we're going to put a timeline on it. We're not going to, 8 years is not acceptable for you to have to come forward and testify now to say that the system is working for the bureaucracy, because as Mr. Bruya alluded to, statistics are being kept. But are we keeping our veterans alive? Are we keeping them in a state where it's okay for them to be home with? I have a veteran right now that said, I can't go home right now because I just got an answer from Veterans Affairs and I'm terrified I'm going to go home and take it out on my family.
Thank you. I'm going just for everybody's benefit, we have enough time here to get at least part of round 3 completed. I'm going to be a little bit more strict with cutting people off, so I apologize in advance for interrupting if I have to. Up next, we have MP Broussard for 5 minutes.
Thank you, Mr. Chair. First, a question of clarification for Mr. Bruya. Sean, you've submitted a document to the committee, I presume, and every member of the committee has that document, correct?
You're on mute, sir. The committee does not have that document, I'm being told. It's not been translated.
Okay, that's sorry about that. So I'm going to suggest that Mr. Bruya table that document and that we have it translated, Mr. Chair. I don't know what the process is for that, whether he just submits it, because there are several recommendations that he's made that may benefit the committee in its deliberation and may actually, in fact, benefit Veterans Affairs Canada. I suspect that that's the case.
Yeah, that would be the right course of action if he submits it to the clerk, and he can have it translated and submitted.
And I did submit it to the committee and the clerk.
Okay, thank you. Mr. Hunter, you know, listen, what a burden you bear, and I know why you do it. And I appreciate the fact that you do it. One of the things that frustrates me as a member of parliament is oftentimes, as is the case with Tina, it gets elevated to a member of parliament's office. And I can recall one situation just after Chris Garnier received his benefits, where I had a veteran come into my office threatening to commit suicide. I sent an expletive-filled email to Minister O'Regan at the time, and within 15 minutes, I got a phone call and an email back from his chief of staff. How often do you see that situation happening, where people are just so frustrated in dealing with the process that they have to reach out? And I happen to think that no one should ever have to reach out to a member of parliament to get benefits that they've earned in representing their country. And I'm curious again with Mr. Bruya, why he would have to reach out to you, given his high-profile status as an advocate for veterans in this country.
Well, a couple things. So does it happen often? I can tell you right now that female veterans across this country reached out as soon as 15 minutes before this began, reached out to me and said, please. So I'm reaching out right now to every one of you members of parliament, regardless of party, to stand up and say it is not tolerable that we've rejected the women in the military and their requests to be heard. It needs to be me too, not you. Why did Mr. Bruya have to reach out to me? I can tell you why. Because in spite of all of our efforts going through policy, saying the decisions that were made by the department were not supported in policy, were not supported by any of the evidence before them, that, and they'll deny this, but the day after Mr. Bruya filed his lawsuit, the funding was cut for a 6-year-old boy. You alluded to Mr. Garnier, who was a criminal in his 30s that was given funding from the very same fund. How can you have a system that says no to a 6-year-old boy and yes to a cop killer? If we can't fix those things, this is all for naught. It's a disgrace that we would put a little boy who fears for his dad's life, let alone his own safety, in that position, and we say yes to a cop killer. Absolutely absurd that we would do that.
Right. Tina, one of the things that really struck me about your testimony is the seemingly disconnect between family members and veterans. Oftentimes, we hear that Veterans Affairs will want to deal with the veteran directly. Oftentimes, that's not possible, and you've spent an inordinate amount of time not just reaching out to Veterans Affairs, but also to your members of Parliament as well. So, how, in your opinion, how do we help family members deal with the situations that are going on within their households?
Well, honestly, for every, I had to get in 2003, 4, 5, 6, when my husband was really sick, I had to get MHAs involved in. Every time he went to a hospital, I had to get an MHA involved. When the doctor tried to take him off some kind of medication and put him on medical marijuana, I had to get the MHA involved. I really don't have any answers for that, because the truth of it is, I had to use them for everything. Like there was.
Yeah. Well,
like,
I'm just, I guess I'm like a dedicated family service, dedicated family line to deal with specifically your situation or others as well. Not necessarily reaching out to the veterans case manager, but maybe there's something, if there isn't already, and I don't know, but maybe there's something that needs to be done to have a dedicated family unit so that family members can feel comfortable. And I see my time's up, Mr. Chair.
Thank you very much. Yep. Up next, we have MP Fillmore, please. Pull down your, there you go.
Tremendous thanks to the witnesses today for coming and giving your time the way that you have, and for all of your advocacy before today. I know it's gone on for a very long time. Very grateful for it. I just wanted to start, Mr. Hunter, you brought the important voice of women into our committee today that had contacted you with regard to the study of the experience of women experiencing sexual assault in the military. And it's really important that we all understand, and that the women that you've been in contact with understand, that the government has not shut down that study. It's moved it to a much more appropriate venue, the Status of Women Committee, where these women are sure in that venue to have a safe and effective hearing of the trouble that they've encountered, that they never should have encountered. It's, the last thing we want to be doing is taking hope away from people who need hope, when it's not necessary that hope be taken away. This study is going to continue, but at the right committee. So I wanted to make sure that we all understood that. Now, there was one other point, and I'm not sure who raised it, but it was about the wait times. And of course, this committee doesn't study successes. It studies what we need to do better, and of course that's why we're all here, and that's why you're here. But it's important to understand that in 2020 to 2021, VAC took 390,000 calls, and 84% of those calls met the 2-minute service standard. And again, we're not here studying the 84% that were met. We're studying the 16% that weren't met. So thank you for raising those points. And in fact, there was a 93% approval rate of people making those calls. We're here to study the 7% that were not satisfied. And so again, thank you for that. But it's important that it does show a record of improvement year over year. But that's not really what I wanted to ask you about. Mr. Hunter, I want to shift gears. You are involved with the Veterans Association Food Bank in Alberta. And obviously, access to nutritious food has a clear impact on our physical and mental health. When any of us aren't sure where our next meal is coming or what its quality will be, that's a very difficult situation. So I was just wondering if you would be able to share a little bit about your experience about how the food bank has made a difference to the physical and mental and emotional well-being of veterans in your community.
Absolutely. So just point of clarification, sir, the Status of Women committee that it got moved to, that doesn't apply to the military women. If you're still serving, you are not allowed to speak outside of the military. So that venue might work for women, but it's not going to work for women that are still serving. My experiences with the Veterans Association Food Bank, the most fundamental thing that Canadians take for granted is the fact that they have the ability to feed themselves at least once and maybe more times a day. Some people more than 3 times a day. But again, when a person does not have the ability to feed themselves on a daily basis, that begets another problem. How did you get there? What are we going to do to make sure that you don't end up back there? And so typically the homelessness and the food part comes because of mental health challenges that were not being met in the societal realm that they live in. And with veterans who are the last to reach out for help, the last to say, I need help, because they've been trained their whole lives to go out and help others and put their lives on the line for others. It's very difficult for a veteran to not only say they need help, but to actually recognize that as their life is spiraling out of control and it starts to fall down those steps of life that most of us take for granted, by the time they hit that bottom step, a lot of them aren't even aware of the journey to get to the bottom of that pile. And so when they get there, we're typically dealing with substance abuse. I'm dealing with a number of veterans that were injured in combat in Afghanistan that have permanent brain injuries. So they're dealing with brain injuries. They're dealing with the not being able to be employed because the brain's not functioning in a fashion that they could. Their families couldn't deal with it anymore, and so families have split up, and so they no longer have family support. They can go into fits of rage or seclusion where nobody sees them. A lot of our guys and gals, we don't know if they're alive or dead until they reach out to us. And so what we're trying to do with a veteran, the fact that we have a Veterans Association food bank is a detriment and a disgrace to the nation. I've never heard of a politician's food bank. I've never heard of a bureaucrat's food bank. But when you're put a food bank out there for veterans and first responders, because we do represent first responders, police. We lost a veteran and a police officer in Calgary, Andy Harnett, God rest his soul. His life was taken by some criminals. But again, now we've got a family left behind. His wife was pregnant at the time. So now we have a veteran's wife that has a brand new baby that wasn't even born yet that has now been added to the mix. And so we're trying to make sure that we're the ones that are catching the people that fall out of the safety net that VAC's supposed to provide, and they do a lot of good work. But there's many out there. We wouldn't exist, and it's Calgary region, but we're reaching from coast to coast. We've got members from coast to coast that want to see our organization. Yeah, we've got one in Edmonton. They've asked to do one in Saskatoon, and on and on. So yeah, that's hopefully I've answered some of that, and happy to talk with you later about it.
Thank you very much, Mr. Hunter.
Thank you very much. And up next for 2.5 minutes, MP Desilets.
Thank you, Mr. Chair. Because we're winding up, I really wish to thank all the witnesses. It was a very constructive meeting. I would like to ask, well, you are all asked a lot of questions. Mr. Bouillet, please. Of course, in the media, we hear that there are a number of committees, or a few committees, I shouldn't exaggerate, especially the one for national defense. There's a lot of cases of sexual misconduct, which is coming to the surface. It's coming out. And this is receiving a lot of ink in the press, and a lot of women are leaving after having been sexually harassed or assaulted. And the Status of Women's Office and the veterans, there was a group created in 2019. Is it enough, do you think, or are there any improvements to be made? And I'd like you to be brief in your answer because I have more questions.
Yes, super. Sorry, just to clarify, Monsieur Desilets, thank you for the question. But you're talking about committees, parliamentary committees, or? Je m'excuse.
Excusez la traduction.
Translation, please.
Not getting the translation either at this point. Can we just the clerk check to see if there's is it back? Okay. Sean, do you want to try start your answer again,
Monsieur le Président.
Okay. Je m'excuse, Monsieur Desilets.
My apologies, Mr. Desilets.
I'm just wondering if you're talking about the parliamentary committees or advisory groups.
No,
No, there was the group created. It was the Office of the Status of Women and LGBTQ women, veterans, created in 2019. Maybe you're not aware of it. That doesn't matter. But do you think that action is enough, or is it relevant in your opinion?
Well, I mean, it's an excellent question, Monsieur Desilets. Thank you. I think what happens is we're having a lot of establishment of committees, studies, the voluntary organizations set up to try to address the problems. And I think those are all reflections that the system is not working. That I think if we're dealing with, for instance, the neglect and abuse of serving members, as Ms. Blaney talked about, is that we have to start talking about also about those that are males, that are females. We have to talk about the discrimination. I mean, military culture itself, and I've written about this and my thesis was about this, but military culture itself is inherently abusive if it's not kept in check. As senior leaderships, we've seen that once you get promoted, they become untouchable. We see the same behavior in our bureaucracy. So, unfortunately, a lot of these decisions and recommendations are going to go back to this very same bureaucracy, these very same institutions, and the ones that are being abusive or not acting responsibly will then, of course, not act meaningfully on those
Thank you.
recommendations. Sorry about that, Mr. Germain.
That's okay. I got to get in here. We're getting real close to time, and I promised everyone would get an opportunity. So, MP Blaney for 2.5 minutes, please.
Well, thank you, Chair. And I just want to
Yes,
close
tout le monde.
and thank so much all of the witnesses today. It was very profound what you shared with us. And with your leave, I would like to go into the motion because I think what we're hearing is so important. And I think it's only reasonable and fair that the Department of Veterans Affairs has the ability to respond to this. And I think a lot of us are looking for some of those responses. So I move that the committee request in writing a response from the Minister of Veterans Affairs Canada to the testimony that was received today on April 14th, 2021, including the brief sent by Sean Brouillet containing his recommendations within 30 days of the date of this meeting. And if you need me to read that out again, Chair, please let me know.
We will. I will remind all members that we did not recommend a report to be done. So I think some clarification in terms of what you want them to respond specifically to.
Well, Chair, thank you for that. The reason I'm asking and proposing this motion is because we did not have that clarity. It would have been great if we had a report coming. We don't. So I'm asking for Veterans Affairs to respond directly to this testimony and to the recommendations that Mr. Brouillet has presented to us. I mean, how the Veterans Affairs chooses to respond, I guess, is up to them. But I'm hoping that they will give us a response, what they heard, and any feedback, I guess, on actions that they're taking to address some of these very important concerns.
Excellent. Can you do me a favor and repeat, for the sake of translation, for those that need it? Would you mind repeating it at least one more time, please?
Absolutely. I move that the committee request in writing a response from the Minister of Veterans Affairs Canada to the testimony that was received today on April the 14th, 2021, including the brief sent by Sean Brouillet containing his recommendations within 30 days of the date of this meeting. And I'll have someone from my team send it to the chair or to the clerk if that's helpful.
Yes, please. Is there need for anyone to get clarification on the motion that's before us? Seeing none. All those in favor of the motion? Or sorry, excuse me, any discussion on the motion? Seeing none, all those in favor of the motion? Oh, sorry, I beg your pardon. I'm sorry, guys, I'm jumping the gun here. MP Casey had his hand up and I lost it in the decor of his background.
I am fine to support the motion. The concern that I have, I'm not sure if it requires an amendment to the motion, is that in the course of testimony today, we heard a testimony with respect to individual cases. That clearly the department is not going to be able to respond to that testimony without some sort of a privacy waiver from the people who've given that testimony. So I think like I say, I do think that the department should be given, the minister should be given an opportunity to respond to what has been heard today. But to a certain extent, they will be limited without such a waiver. As long as we know that they will be subject to that limitation, then we go into this with our eyes open. With that said, I'll be supporting the motion.
Any other discussion? So in this virtual format, I think it's just a matter of, do we have unanimous consent for the motion? Is there any dissent to the motion? Seeing none, the motion carries. I want to thank all of the witnesses for being here with us today. I appreciate the overwhelming sensitivity of each of your cases and the work that you're doing. And I can speak on behalf of at least the members of this committee that we are in agreement that improvement is needed, and we need to continue to move it. On the one issue I will comment to was Mr. Hunter's mention of a military not being able to go to the study that is currently being conducted. I can assure him that is in fact happening. There will be members of CAF have and will continue to attend those hearings on that incredibly important issue. So again, thank you to all my members of this committee. Thank you to
Chair,
the technical.
can I, just a point of order, if you don't mind, just if the committee clerk can send the motion around, like the actual wording of the motion to all the committee members so that we have a record of it.
Yeah,
I would appreciate that.
Once it's been translated, we'll distribute it.
Perfect. Thank you, Chair. And I see Mr. Hunter has his hand up.
Mr. Hunter? Oh, you're muted, sir.
I would ask the indulgence of the committee to make sure that the witnesses get that as well. And Mr. May, just point of clarification. I understand that the ability of women in the military to come forward is out there from a theoretical sense, but based on past history and what I've heard is one more time they're being told to hurry up and wait, and here's another committee. And so the willingness of those victims who are just traumatized is the biggest point that I like to make.
I can't agree with you more. Prior to this parliament, I was the chair of HUMA, and we oversaw C85 or C65, which was violence and harassment in the workforce. I can assure you, I am very aware of the trepidation and challenges of coming forward, and so are many of the members in this committee, all the members of this committee. But just a big thank you to you, sir, for the work that you do. I will wrap up here by simply reminding everyone that the 19th, I see you, Scott. Let me just finish here, and then I'll come to you. The 19th, we will not be having a meeting. So our next meeting will be April 21st, which we'll be hearing from witnesses on the study of support service and veteran caregivers and families. It's our last meeting on that study. Scott. You're on mute, sir.
Thanks, Mr. Chair. I may be out of order, but I just want to thank Alan, Tina, Sean, and I'm going to follow up, Tina, and see if the Auditor General report for Veteran Affairs has been implemented. Somehow I doubt they have. Okay, thanks so much.
Thank you very much, everybody. Thank you to all the folks in Ottawa that make it possible to be heard and to be seen. Thank you, and I adjourn today.
Thank you very much, everyone.